Good afternoon or good morning, everybody. I'm Amanda Lufin from Human Rights of Water. Today is Human Rights Day. It's normally held on the 10th of December, and it's the day that the United Nations General Assembly adopted in 1948 the Universal Declaration of Human Rights. The 2020 theme is Recover Better and Stand Up for Human Rights. It relates to the COVID-19 pandemic and focuses on the need to build back better by ensuring human rights are central to recovery efforts. We'll reach our common goals only if we're able to create equal opportunities for all, address the failures exposed and exploited by COVID-19, and apply human rights standards to tackle entrenched, systematic, and intergenerational inequalities, exclusion, and discrimination. How very fitting for our 7th webinar to deal with issues connected with the human rights to water and sanitation. This is the 2nd webinar that we featured on the current pandemic and the connection with rights to water and hygiene. And we're investigating further how we can use this moment in time to bring attention to these crucial human rights. Water and sanitation for marginalized people are historically the poor relations when it comes to investment and attention, as they seem to be not as exciting as the investment in other large-scale infrastructure developments, such as roads or energy plants. For our discussions today, we've pulled together experts in human rights and senior people that represent their government authorities in the 2 countries that we would like to use as case studies today, Kenya and Costa Rica. Both these countries are exceptional because they have included the human rights to water and sanitation in their constitutions, but they're still working on the implementation of these laws. We start with a presentation from Rio Hada from OHCHR, who will place in our minds the difficulties facing especially the elderly people of today. This is followed by a resume of the methodology that has been developed by Human Rights of Water and the initial results from the 12 countries that have already been analysed with the help of White & Case, the international law firm. Our 2nd session concentrates on case studies from the 2 countries, aiming to share with you the challenges and legal steps that both have taken to deal with the pandemic and using the Human Right to Water tool as a framework for analysis. First of all, we look at Costa Rica, and we're fortunate to have the head of the Water Authority, AYA, from Costa Rica, Jamilet Astorga, in a presentation and discussion with Geraldine Hene, our legal director, and previously a lawyer and judge in the same country. And our finale and last case study involves the University of Nairobi professor and expert in COVID and human rights, Professor Patricia Bote, and the head of the Water Regulatory Authority, WASREB, from Kenya, Engineer Robert Gakubia. We will hold this session as a blend of presentation and interviews in order to understand the challenges in Kenya and the steps they're taking to deal with the pandemic. Professor Sharmila Murthy from the University of Suffolk, an expert in human rights to water and also a board member at Human Right to Water, will moderate this session. So if I can first of all introduce Rio. He is going to talk to us about how to protect the human rights of older people in today's world. He's currently coordinating the work of the UN Office of the High Commissioner for Human Rights in the area of economic and social rights. He's also the focal point on human rights to water and sanitation and leads the work of OHCHR on the human rights of older persons. Rio Hada.
Thank you, Amanda. Thank you for the introduction. And thank you for inviting me to speak at this webinar on this Human Rights Day. Trying to share my screen. There you go. Is the screen share working? Okay. So as Amanda introduced, I'm going to speak about older people. And why older people? Well, there are a few reasons. First of all, our population is aging and rapidly. By 2050, 1 in 6 people in the world will be age 65 and above. By comparison, today we have 1 in 11 people, so that's almost the double. In some regions like Europe, 1 in 4 people will be over 65 by 2050. So today we are living longer, largely thanks to improved health conditions, improved access to safe water and sanitation, and progress in many areas. But at the same time, this growing population of older people is at the risk of being left behind, undervalued, and their potentials unexploited. Secondly, the COVID-19 has clearly demonstrated this risk and a particularly devastating impact on older people. 90% in Europe, 80% in US, the majority of deaths from COVID are older people. This is because older people have a higher risk of dying from the virus, particularly when they already have underlying health conditions. And we have seen disturbing reports of older people contacting virus and dying in care homes. Majority of workers in these long-term care institutions are women, and many are older persons themselves. The physical distancing and lockdown measures have aggravated the social exclusion of older people with a heavy toll on their mental health. The economic crisis from the pandemic may significantly reduce older people's income and living standards, and the lockdown and stress may lead to increased violence, neglect, and abuse against older people. And COVID-19 has escalated entrenched ageism, including age-based discrimination and stigmatization of older people. It is worrying that there have been remarks and hate speech targeting older persons in public discourse on social media. My third point is that older persons face specific challenges to water and sanitation, but we need more evidence and data specific to their challenges in order to develop effective responses. Here, the tools developed by Human Rights to Water, a very good start in collecting more specific information relative to the challenges faced by vulnerable groups in analyze in terms of key elements of the human rights to water, sanitation, and human rights principles. What you see on the screen is some findings from a recent report by the Help Age International, which they interviewed almost 9,000 people aged 50 to 80 plus affected by natural disasters, conflicts, or socioeconomic crisis in 11 countries in Africa, Asia, Latin America, and the Middle East. And this is what the older people have said. 25% had no access to safe drinking water, 62% had no access to bathing facilities, 36% had no access to hand washing, and 35% could not get to a toilet. So this is indicative of the general challenges facing older people in realizing their rights to water and sanitation. So let me unpack them a little bit in terms of some of the key elements of the rights, in terms of availability and accessibility, physical distance to get to water sources or water collection points, particularly difficult for older people with limited mobility. Affordability, in many countries, old age is associated with loss of income, so the cost of water is occupying a large amount of their daily spending. Adaptability, facilities not adapted to older persons, like toilets. Accountability, age-specific data to monitor the progress is largely missing. And lastly, on participation, older persons are treated as recipients and not fully involved in the process of developing those measures. So how can we better protect the rights of older people and make a shift to a human rights-based approach to water and sanitation? Most of what I'm going to say here apply to other marginalized groups as well, but there are some specific aspects about older people. First, we need to start by shifting our mindset about older people and about aging. What is different from other groups is that aging affects us all because we all age without exception, right? But often we tend to look at these groups like older people from vulnerability lens, focusing on their weakness and needs even as liability to the society and economy. This must change as older people are an incredibly diverse group. Not everyone is necessarily weak or frail, but if we treat them as such, they will become weak and dependent. So a human rights-based approach will focus on their capacity and contributions and supporting their autonomy and independence for as long as possible. This pandemic has amplified the existing inequalities and exposed a structural weakness in our society to protect the rights of older persons. So in building back better, we need to put the rights of older persons at the center of our efforts. And this means, first of all, combating ageism, which means shifting our mindset, just as I mentioned, and addressing age discriminations in laws, policies, and practices. We should bear in mind that some of the age-neutral measures may still have negative impact on older persons, such as disruption to non-compete health services or information available only online. And second, we need to improve data on who has access to water and sanitation and disaggregate them by age, gender, and disability status. This is essential for policymakers and development actors to design appropriate interventions that focus on improving access for the people and other vulnerable groups. The third, states need to prioritize investment in social protection, infrastructure for water and sanitation, and health services that build resilience for future pandemics. And fourth, integrate human rights standards and principles in developing age-inclusive policies and measures to improve not only access to water and sanitation quality, but also to ensure that design and facilities are adapted to older people's needs and capability. And lastly, older people in communities must be consulted and involved in the planning and design of water and sanitation facilities and in monitoring access and qualities. So I very much look forward to hearing about the case studies and efforts done at the country level to look at some of these elements to ensure that the rights of the people are at the center of the Building Back Better. Thank you very much.
Thank you, Rio. And I think very much at the heart of that is, and the solutions lie with the human rights-based approach and participation of older persons. And we're going to invite Rio to come back and talk to us again after the case studies to make some more comments. So we'll see you again soon. And thank you. And going from the older generation to the younger generation, we now introduce Imanol Aguilera, who's going to introduce to you the methodology developed by Human Rights of Water and our first results as tested by White and Case. Imanol is a young Spanish and Uruguayan professional born and raised in the Geneva region, and he's a legal researcher specializing in international water law and human rights. Having worked at Waterlex, he's now part of the Human Rights of Water team, and I'd like to welcome him to make his presentation. Imanol.
Thank you, Amanda, and hello, everyone. It's a real pleasure to be here today. So I will now present some of the initial results that we have gathered from the resilience tool developed by Human Rights of Water. This tool evaluates the degree of resilience of various countries to pandemics and other emergencies. While the research is not yet complete, preliminary findings provide some good insight and help with thinking about the potential steps required to foster resilience to emergency situations, while ensuring the full realization of the rights to water and sanitation. The presented cases of Costa Rica and Kenya today will notably help us to illustrate the scope of our approach and the potential benefits of using this tool. So first, what do we mean by resilience? Our tool proceeds from the understanding that if the standards of the human rights to water and sanitation are comprehensively integrated and upheld in the national legislation, then a given country is better prepared to handle future pandemics and provide efficient emergency responses. Starting from this premise, the tool assesses national and local governance systems through an evaluation of the key attributes of the rights to water and sanitation linked to hygiene, control of disease, and health. We look at the law in the broader sense, including all kinds of mandatory statements and policies that regulate these attributes. Ideally, resilient countries are those that have a comprehensive array of regulations aimed at dealing with emergencies and drafted in such a way that all the guiding principles and criteria of the human rights to water and sanitation are included. The expected outcomes of a resilient framework include greater priority to continuity of supply, availability for vulnerable people, affordability for all, consideration of hand-washing facilities, quality of drinking water, and management of contaminated waste. This tool has been applied to 25 countries based on the following elements, and the results are intended to provide incentives for governments to give more priority to wash for the most vulnerable who often lack access to adequate wash facilities. At present, phase 1 has been completed with the support of the international law firm White & Case, and surveys are being conducted in phase 2 and phase 3 countries. Looking now at the resilient tool in more detail, the surveys are organized according to the normative content of the human right to water and sanitation and their procedural guarantees. Availability is one of these components, requiring that water must be available in sufficient quantities for personal and domestic uses. This usage should be prioritized, as the global health crisis has highlighted that ensuring availability of water and sanitation services is even more critical in times of crisis. We have assumed in the tool that a country needs to comprehensively address availability in order to achieve a positive resilience score. For example, we are looking for guaranteed minimum volumes of water per person. Positive answers are given 2 points. Taking these examples, if there is no law to address emergency responses in the face of water cuts, then the score will be 0. The survey conducted in Kenya provides a dashboard summary of the situation in the country. It maps the most relevant legislation and displays an overview of good practices that have been carried out. It also identifies the most visible gaps in legislation and policy. Bear in mind that these results should be treated with caution, as they can be subject to change and they require further validation. We can notably observe that the human right to water is enshrined in the Kenyan Constitution and that the national legislative and policy frameworks address water and sanitation in numerous ways, notably through the Water Act and the National Water Plan. Priorities in the allocation of water for different uses are also accounted for in the law. Looking at the preliminary pandemic resilience score, 100 being the highest possible score, we can identify general trends. For example, quality and acceptability seem to be well accounted for, while there are potential improvements needed in terms of affordability and participation. This specific graph summarizes the level of implementation of the rights to water and sanitation with respect to resilience to pandemics in 12 countries. Each line represents a country and each color corresponds to one of the composing elements of these rights. For instance, the non-discrimination principle is displayed in green and the yellow color represents accessibility. This system of benchmarking enables countries to compare their practices with others and is intended to stimulate the exchange of good practices and cooperation. On the other hand, this graph displays the cumulative resilience score of countries by criteria. At first glance, we see that the quality criteria is prevalent and generally well integrated, as the average score is around 75%. However, these results should be contextualized, as the scores of countries that are deemed to be more developed and with colder climates may conceal gaps in others. Indeed, there seems to be a disparity between countries in the global north and those in the global south. In general terms, the water governance frameworks of the former may be considered more resilient, as their average score is 65% as opposed to 35% in the global south. Taken together, the average score of the 5 criteria is around 50%. Such results illustrate that much remains to be done to increase countries' resilience, notably in terms of affordability, where countries have scored lows. Again, these preliminary results leave the door open for debate. Looking at the level of integration of the human rights cross-cutting principles, we can also identify some trends. Evidence suggests that there is still room for improvement in terms of participation and non-discrimination. This raises questions about the different forms participation takes in practice, whether it is really inclusive and meaningful, or whether vulnerable groups, such as women, play an active role in decision-making. On the other hand, mechanisms of accountability seem to be relatively integrated on average. Nonetheless, there are persistent gaps in national frameworks, notably in terms of complaints and redress mechanisms. Countries also appear to score high in terms of access to information. The fact that some countries score 0, however, reminds us of the importance of contextualizing these scores. Finally, when looking at sustainability, countries are increasingly integrating this principle, but there is an apparent lack of plans for emergencies on the matter. All these elements must therefore be considered. We mentioned the crucial need for validation. The cases of Kenya and Costa Rica are relevant here, as our results have been reviewed by the national water authorities. Here are some examples of the good practices adopted by these countries. In terms of accessibility, Costa Rica includes special consideration to protect indigenous groups from COVID-19, and there are directives in place in Kenya that ensure access to wash facilities for marginalized groups in times of emergency. In terms of affordability, Costa Rica has implemented a mechanism of additional subsidies for the poor while maintaining public service prices in the context of emergencies. In Kenya, a system to ensure affordable tariffs for vulnerable people during crises has been put in place. In summary, the Human Right to Water Resilience Tool offers several potential benefits. Based on the legal and policy mechanisms that are being put in place, guidelines and recommendations can be formulated to help closing gaps and creating more country resilience. Caution is needed when analyzing results, and working bilaterally with countries for validation and feedback is therefore crucial. The question we need to ask ourselves now is, how can we best use this information to support countries to save lives during the pandemic? Thank you for listening.
Thank you very much, Emmanuel. That was a great presentation and summary of the work that we're developing. And as you'll see in the next half of the webinar, we'll be going into more detail about what that means for 2 of the countries. And thank you for that presentation. So I'd like to move now into session 2. Into the case studies, and to consider first of all the case from Costa Rica. We have a presentation from Jamilet Astorga, who is currently the executive president of the Costa Rican Institute of Aqueducts and Sewers, AIA. She was responsible for driving the participatory process of building the new law on water resources in Costa Rica from 2001 to 14. And as an academic and researcher at public universities for nearly 20 years, she's consulted for various national institutions and organizations, including the State of the Nation of Costa Rica, the Ministry of the Environment, and international organizations such as the Central American Commission on Environment and Development. This next session's discussion will be moderated by Geraldine Gene, the Legal Director at Human Rights of Water, also from Costa Rica and a former judge. She has more than 20 years of experience as a private lawyer, litigator, trainer, and consultant, and she's an experienced coordinator of projects and cross-sector multi-level social programs. If I can please hand the floor over to Geraldine and Jamilet. Jamilet, perhaps you would like to, Jake, can we focus on the gallery, please?
Shall I start? Or? Yes.
Geraldine, are you going to introduce Jamilet?
Yep. Okay, thank you very much, Amanda, and everybody that is participating all here. It's a pleasure really to be with you. I really would like to tell about how is the drinking supply in Costa Rica and sanitation in general. I have to tell you that in Costa Rica we have 93% of drinking water coverage with the ANA, which is the institution that I represent, the Costa Rican Institute for Water Supply and Sanitation. We cover 50% of the population in the country, but also we have 30% of the population is covered by local organizations, which are more rural, but something that is very important is that AIA has to be with them. I mean, we control all our rules, cover them, and so that they have They are control the quality of the service, but also the quality of the water. And we have a rule very strict on water quality. So we really drink water from the tap in almost all the country. So that is something that already, let's say, it's appreciated from the country. In this time of pandemic, during the time, we approve the right for water supply at the most high level of our constitution. So we have it already there, and it was during this time of pandemic, we have to approve many things like our let's say a decree of emergency that allow us to create new infrastructure and to really put attention mainly to those people which are living in the rural places and a very long distance, but also to the indigenous people. So we have, and we have it in our national plan to build aqueducts in indigenous territories. During this 7 months long suspension to water supply cuts, we still don't cut services in homes with people with the COVID-19 disease. And we have invested $55 million in this emerging plan to increase water quantity, mainly in the metropolitan area. Why? Because when the pandemic starts in the country, we were in the driest year, the driest station of the year. So we have problems with water availability. So we have to introduce projects, but also we were bringing water to different places where we have problems to give the water supply. We introduce many protocols, new protocols to ensure soap and hand washing facilities in all the establishment. I mean, if you reach a restaurant, even a hotel, or even in the beach, you will find place where you have to wash your hands. For instance, if you go to the agriculture area of, where you find, where you buy the products like the vegetables and fruits, before to enter to the fair, you have to wash your hands, and you have to use also alcohol. So there is a protocol, very strict protocols, and related with quality of the water. We have a very strict regulation, as I told you, under the health minister. And when water bodies suffer from any episodes of contamination, we look for alternative water sources and activate emergency plans. Of course, the communities are very well informed, continuously informed. We have a program to test the presence of SARS-CoV-2 virus in wastewater. That was also something new that our National Laboratory of Water, which is also from ANA, we started a research since March of this year. We have already the technique, and so we started to analyze SARS-CoV-2 in the wastewater. As an acceptability, water and sanitation facilities and services must be culturally and socially acceptable. There are several surveys on the quality of service made by ANA and also by the regulatory and by the general control of the Republic. And of course, our National Water Laboratory, as I told you, continuously analyze the waste taste, the water taste, smell, color of water, including during emergency, of course, physicochemical analysis and bacteriological analysis. I think the time is over. Do I have more time?
So Geraldine, I think you have some questions. Is that correct?
Yeah. Well, hi everybody. I'm very glad to be here with all of you. Thank you very much, Jamilet, to be with us today. It's very nice to have somebody from my country here and supporting all this work that we are done. We have selected Costa Rica for this first discussion today because, as Jamilet says, it has recently incorporated the human right to water into its constitution, was in May this year. And it represents an important step in international obligations. I want to tell you that as a country, Costa Rica ratified 13 international human rights treaties of the UN system, and it reports regularly to each body and respond of recommendations. Many of these relate to the implementation of the SDGs and are related to the administration of justice, rule of law, labor rights, and adequate standard of living, inclusion of vulnerable groups, and also access to water and sanitation. As Imanol, my colleague, says, we create a tool to help national and local government to assess the ability to realize the human right to water and sanitation in the emergency, like such a COVID pandemic. And the first country that we analyzed was Costa Rica. Well, it's my country, then we can go through. And it's why we are talking today with Jamilet. I have some questions, yes. We have seen with this tool that the country has obtained a very good score in the evaluation. And I would like to know from you as the head of the AIA, if you consider that this tool could be used as a guide for decision-making to facilitate respect for the human rights to water and sanitation.
Thank you, Geraldine. This tool considers several criteria and principles related with human rights to water and sanitation, like availability, quality, acceptability, accessibility, and different principles like non-discrimination, the access to information, the participation, and others. And this is like a test that allows us for decision-making to evaluate what are the weaknesses and to strengthen in utilities, let's say, like us as operator for water supply and sanitation, and the country, and could support greater resilience to future contagious diseases. The application of this tool, I really believe will contribute to evaluate if we are under the due diligence.
Thank you. I know, and you confirm when you speak, that during the pandemic, Costa Rica and the rest of the country in the world have introduced a lot of like COVID norms. That is, understanding by that, like all kind of mandatory standards related with the pandemic, decrees, laws, norms, etc. Have these norms created sustainable changes to the way that water and sanitation are being supplied?
Yes, as I mentioned before, we introduced a lot of norms. There were no establishment, let's say commercial establishment allowed to open if they don't have create a norm, a protocol, and this protocol must be allowed by the Minister of Health. For instance, as I mentioned before, we introduced the hand washing, and absolutely every establishment, restaurant, clothing store, cinema, hotels, even the national parks, and also the beaches, this can only be achieved with a good and comprehensive water supply, sanitation, and hygiene services. only in case of extreme drought and informal settlements of very rural and dispersed communities where it's possible to place storage. We put different storage tanks and we were filling them with tanker trucks. I believe that this form is not sustainable over time, but the population is served immediately and it is not abandoned or discriminate against for not having the supply services. The emergency decrees that we approve, which they allow us to execute infrastructure with environmental exception in such a way we achieve their execution in less time. So all of these, let's say, we are applying in this case, but I'm sure this came to stay.
Okay, thank you. Okay, when we talk about human rights, we must always focus our attention on the most vulnerable populations. When we talk about human right to water and sanitation, the vulnerability of the population varies depending on different factors, such as areas, climates, population density, among others. Costa Rica has been significantly affected by climate change. And it's what you say, when the pandemic arrived, there was a big drop. And just a few weeks ago, we have an emergency because of the floods. Then do you personally think that this resilience tool can help the country to be more prepared for future pandemics or other type of emergencies? And can you give another example of a law or regulation that has been introduced that will make a difference in future?
In fact, Geraldine, the climate situation in Costa Rica is like that of an island, let's say. We are affected by the phenomenon of El Niño and the Niña, extreme drought and extreme rain, which are increasingly frequent. Before we were having these like each 7-10 years, and now is each year. Both extreme hydrometeorological situation mean that any pandemic affect us, not only vulnerable communities, but anyone. In Costa Rica, we have an emergency law that articulate us from local governments with the participation of different leaders of the different communities to institutions at the national level. This means that we can act almost immediately and that those affected waters and sanitation services are among the first to be restored. The weaknesses identified in this tool allow us to take measures as opportunities for improvement to introduce and strengthen. For example, the development of plans and is subsidized by the government. All our investment are doing by ourselves, by the cover of a tariff. The government don't give us money, but with this, I think it's a way to present to the government the importance, also to give money to us, the operators, to subsidize in these cases. With emergency, the National Emergency Commission, they receive money from the government and they are the ones that are collaborating with us to attend all of this. But the plans is something that we identify applying this tool. We have to go further with the creation of these plans. So we are organizing, and I think we are organizing well. This tool, it helps us to identify which are these weaknesses and gaps, and I think it will help us to take decisions.
That's great to hear from you. Well, as you know, our mission is to share knowledge on how to integrate the human right to water and sanitation into law and policy. And as you say, this tool can be used to identify those gaps. And do you think it could help in this time for the most vulnerable people too?
Yes, I believe that this tool is quite complete with a comprehensive vision and allow us to easily identify those gaps and weaknesses. And this contributes not only to the water supply operators, but to the government, as I mentioned, to strengthen those areas.
Okay. Well, thank you. The spread of COVID-19 in areas where there is insufficient water for personal use provides a stark reminder that one of the most effective ways to prevent disease is also one of the most simple, the hand hygiene. And it not only protects us from contracting these and other diseases, but also stop transmission to other people. To be prepared for future emergencies is important to create resilience. And as Imanol says before, resilience is generally understood as the ability for individuals to achieve goals and to succeed despite adversity. We consider that in the context of emergencies, resilience can be increased when there is a legal framework that supports the correct behaviors. This resilience tool provides a guide to ensure this legal support for governments and water authorities with examples of good practices, as well as highlighting areas where law and policy can be strengthened. Thank you very much, Jamilet, for sharing your experiences with us today. Your perspective is hugely helpful to all of us, and Costa Rica provides some useful reference for other countries. We welcome further questions from the attendees, either through the webinar today, or please get in touch with us directly. Thank you very much, Jamilet.
Thank you, Geraldine, for the opportunity.
Thank you. And I don't know, Amanda, please.
Yeah, I was just going to remind you to invite Rio to make a comment at the end of this session. Rio, would you have something to say?
Yes, very quickly. Thank you very much. Thank you, Imanol and Jamilet, for your presentations. First of all, I very much agreed what Imanol had said, that if standards of human rights to water and sanitation are fully respected, we have a resilient society. And it's important that the Costa Rica has recognized human rights to water and sanitation in the new constitution, and very much hope that the Jamilet will continue the path of your commendable efforts. I particularly appreciated that your government has made special effort to reach out to the indigenous population, and you also mentioned about sort of the balance that you need to make between focusing on immediate short-term responses, emergency responses, but we need to keep working and investing in a more long-term agenda for water and sanitation that will eventually strengthen the resilience. So thank you, and I'm very impressed to see that according to this scorecards that you have did very well in terms of particularly on human rights principles, like access to information and participation. So it would be good to that your experience could be shared with the with other countries, as Imanol said that many countries scored very low in terms of participation in those areas. So thank you very much, and congratulations again.
Thank you, Rio, and we'll need to move on to the next session without us answering some. There's a couple of questions on the Q&A, but I'm hoping that we will answer them in general as we go along. And if we don't get to all of the questions, we can maybe communicate directly with some of the attendees that have asked specific questions. Thank you for your comments, Rio, and we'll now move into session 2, and I'd like to introduce Sharmila, who is going to moderate this session, and introduce the other speakers. So Sharmila Murthy is an associate professor at Suffolk University Law School, where she teaches the rights on issues of property law, environmental law, international environmental law, poverty, and human rights. Previously, Sharmila co-founded the Human Rights to Water and Sanitation program as a fellow at Harvard Kennedy School Carl Center for Human Rights Policy. And in 2014, Sharmila was selected as a finalist for the United Nations Special Rapporteur on the human right to safe drinking water and sanitation. She's also now a board member at Human Right to Water and is moderating our final session today. So may I please introduce him?
Wonderful. Well, thank you so much. And first, let me just say thank you to Amanda and to the wonderful team at Human Right to Water, because on Human Rights Day, it's a day for us to reflect and to think both about the legal standards and norms that we've articulated as an international community, but here really thinking about implementation and really thinking about how do we create a more resilient response to global crises like COVID. So I am so thrilled and honored to be on a panel with two very esteemed people from Kenya who will be speaking about the progress that has been made there and remaining challenges. So first, it is a real great pleasure to introduce Professor Patricia Kameri Bote, who's currently a professor of law at the School of Law, University of Nairobi, where she's taught for over 30 years and also served as a dean. She's also an advocate of the High Court of Kenya and was conferred with the rank of senior counsel in 2012. She's also been instrumental in the International Environmental Law Research Center, where she served as founding research director and the program director for Africa. So we'll be starting with some opening remarks from her, and then we'll be having a brief Q&A with Robert Gakubia, who is the CEO of the Kenya Water Services Regulatory Board, and he was previously the Director of Water Services at the Ministry of Water, Sanitation, and Irrigation. So frankly, we've been so thrilled to have two such esteemed people on this panel. As Director and CEO, he has been instrumental in implementing a reform agenda needed to ensure a more accountable, responsive, well-capacitated, resourced, resilient, and progressive water sector in Kenya that is in line with the human rights framework. So with that, let me turn it over to Professor Bote to begin her remarks.
Thank you very much. I'm very happy that you have me today. I think the Human Rights Day is a good day to talk about human rights to water and also to look at human rights and how they've been affected by COVID. And basically, I'd just like to give a context on what's happening in Kenya. And from the report that Emmanuel gave, it's clear that Kenya has put in place the laws and policies to implement the right to water. But I'd like to point out that the right to water in Kenya is a factor of available water resources. And the water sector in Kenya, as in most of Africa, is strongly influenced by climate change, with Kenya being classified as a water-stressed country facing chronic water shortage. And if the available water resources decline as is predicted, the country will be facing absolute water shortage by 2050. Our constitution, which was put in place in 2010, has both the civil and political rights and socioeconomic rights. And of course, the state then has the obligation to respect, protect, and fulfill these rights. And it's in that context that Kenya has put in place the laws and policies to implement these rights and to have them realized. The Constitution also has an all-encompassing provision on equality and a very firm requirement for public participation. But most significantly, it recognizes the right to water and reasonable standards of sanitation in the Bill of Rights. The Water Act 2016 is aligned to that constitutional standard, and WASREB, which Engineer Gakube will talk to us about, is charged with ensuring the realization of the right to water. The quest to ensure the realization of the rights to water and sanitation for all Kenyans, that's women, men, boys, girls, marginalized communities, persons with disabilities, and the elderly, is really an enduring one. And within that context, when the first case of COVID was it discovered, or it found itself in Kenya in March, we see that COVID became a vulnerability and threat multiplier, because it found the citizens the way they were, dealing with climate change, extreme events, floods, etc., and what I talked about before, the water stress. So COVID-19, in the context of the status on right to water and sanitation, affects the adequacy of water. And so the quest for the 4AQ, accessibility, availability, affordability, acceptability, and quality, has really been affected by COVID. And COVID actually is likely to have compounded existing problems for different segments of society, and wasn't discrimination and inequalities, or even given rise to new inequalities. Because one of the ways of managing COVID is the frequent washing of hands, raising the need for constant water supply. And for households with limited access to water, especially in urban informal settlements, this is a challenge, because they already are stressed looking for water for drinking and domestic purposes. And in that context, then, one looks within Kenya at the water governance and how that aids or constrains access to water. And from work we have done, we've seen that water governance is gendered, it's plural, it's multi-sided, and it's complex. And actually, rights of vulnerable groups have proven difficult to deliver. There is actually a complex interplay among not just the international and national norms on human rights, but we also have local norms, and we have local institutions which also impact on the right to water. So in essence, when one looks then at water governance as a system of actors, resources, mechanisms, and processes mediating society's access to water, we see a plethora of actor structures and interests. And while the state is the main duty bearer, it is by no means the only actor. And in certain spaces, it is absent. And where it is absent, then you have other actors coming in, whether they are private vendors or local communities mobilizing. And all these contribute to the realization of the right to water. So in conclusion, despite the legal recognition of the right to water and sanitation in Kenya, its enjoyment is not yet fully realized. Pandemics like COVID-19 exacerbate the situation for the vulnerable because they limit the existing opportunities and further constrain their capabilities, what they are able to be and to do. Pandemics also affect people's lives in other unexpected ways. For instance, certain communities' burial rights require people to be there, and water is needed. And we've seen spaces where people are crying out for not having enough water. COVID has also put a beamer on the rights of nature. And here we are looking at how can we ensure that we are not overusing the environment so that water resources are there and they are allowed to recharge. So in a nutshell then, it's important for us to explore ways of using the constitutional provisions in Kenya to prepare for pandemics, to frame responses and interventions which amplify rights rather than claw them back. And we also need to ensure that we build resilience to pandemics for all, because the presentation that was made on the elderly raises the issue of intersectionality, because there are men and women amongst the elderly. So the disadvantage of the elderly is likely to greatly affect old women. Thank you.
Wonderful. Thank you so much for a wonderful overview and a way of connecting the law to the challenges on the ground. Now we'll turn it over to Engineer Robert Gakubia to maybe offer some more additional insights. And as CEO of the Kenya Water Services Regulatory Board, you are very well positioned to perhaps share with us how exactly has the human rights to water and sanitation been implemented in Kenya? What challenges did you face before? And now with COVID, what challenges have been exacerbated?
Thank you very much, and I'm honored to be part of this discussion. I want to say from the outset that the right to water implementation in this country started even before the declaration of 2010. We actually started way back in 2003 by actually at the policy level publishing a guideline that connects whatever we were doing in the reforms in the sector to the right to water. So when the declaration was coming, and especially when specific to our country, we had the new constitution, it was codified, at least it was a kind of a validation of what the sector was doing. In fact, the right to water was the first principle guiding implementation of water service provision in this country. So we have basically operated guided by that human rights framework throughout. Now, as it had been said by other speakers, it is of course not enough. It is good to have the right to water in the constitution, but of course, and we have done that, but a lot remains to be done to make sure that these rights are realized. And that is one of the reasons why under the reform, we also brought in regulation. Regulation was actually supposed to address one of the challenges the sector was facing, and this was a governance risk. So regulation was supposed to actually come in and to reduce the governance risk through strengthening accountability of the actors within the water space. Yes, as Professor Bote has said, the government is a primary duty bearer, but because of the slow progress in terms of meeting the rights to water for the population, of course, other actors came in. And as a regulator, I think we are also trying to coordinate these other actors, especially with regard to formalizing water service provision. But one of the successes we are almost making is actually what Emmanuel said there about bringing in the standards into the legislation. For a long time, our actors, I just mentioned the right to water. But through lobbying and whatever, we hope that within a couple of months, perhaps, then the standards themselves, as mentioned there, the 4 A's and Q, will actually be legislated. And once they are legislated, then we already have a foundation for building resilience. So there are challenges there which we have been addressing, but at the end of the day, access remains a major challenge, because as I've always said before, talking about the right to water when there is no access or even other challenges that water may be facing doesn't really do much. So it is important that we bring in the access, and that access faces challenges of resources, of course, the capacity of the sector, and many other things. And for us, the resources, the gap is big, as it is mentioned, but we know that we can do better with the resources we have. I also want to highlight a point which I always try to emphasize. Yes, this country is water scarce. It's water scarce under international benchmark, but we have hardly developed 10% of the available water, and that actually makes the problem even worse. So as we address the challenges of declining water resource, we also need to address developing whatever water is available to use by people in their socioeconomic activities, and especially also in for their public health needs. So COVID-19 has come to compound the problems that the sector has been having. They are saying that if you really, it's a sector that has had underlying issues, if I could say that, and these issues have been made worse by COVID-19. But we are there in terms of making sure that that we are able at least to address this emergency in the best way possible. The government has already given directives with regard to how we should handle water service provision in this emergency, and it has also come into support together with the partners that are also working with us in the sector. So we continue implementing the right to water, but the challenges are quite huge as we proceed.
Wonderful. You know, I'm wondering if you could give a little bit of specificity. You mentioned early on that even before the COVID pandemic, that Kenya had really begun to develop standards that would put numbers or standards to the legal norms. And I'm wondering if you could give just a couple of examples of what you mean by that.
Basically, this is trying to unbundle the normative content of the right to water. If it is about availability, we have tried to put in a minimum of 20 liters per person, but also highlighting the fact that yes, that is minimum, but we would like to see a situation where we come to the international standard of a minimum of 50 liters per person per day. We also bring in standards with respect to asset development and also issues of affordability. For example, in terms of affordability, we have tried to make sure that the lower band of consumption between 0 and 6 cubic meters is actually affordable to most of the population. It has its challenges, but we as a regulator, we try to make sure that even when we discuss tariff changes, that band is not significantly affected. There is also the issues of managing the water itself in terms of the managing the water service provision. We also have governance standards, which we are trying to implement because governance has been a major challenge. And this is basically about management of the water service itself and issues to do with water losses. Even as we talk about resources, we are losing about close to 100 million USD in terms of water lost. And that I think can be significant when it comes to a situation where a sector is facing these huge challenges of the resource itself and also of the financing for service provision itself.
And can you say a few words then about, I think you mentioned as well that COVID and the global pandemic has exacerbated some of these challenges. And I think Professor Bote said it's a threat multiplier, which I thought that was an important phrase there. So but then you also mentioned that the country has in fact implemented some regulations or taken some steps. Can you tell us about those steps that were taken?
The steps is more or less what you would actually do in a public health emergency. The steps are we focus on the vulnerable groups. All water service providers focus on the vulnerable groups. There is no disconnections of water, although I really do not think you can disconnect water in a public health emergency. But at the same time, when you focus on the vulnerable groups, and now we are also talking about the shortage of the water itself, then we also address it through different ways. You can actually have emergency interventions to make sure that there is water available, and through various technologies and through various means. And also in terms of supporting the water service provider themselves to actually continue sustaining the service. And what is happening there is that there has been already available fund of about 5 billion Kenya shillings supported by the World Bank to make sure that the companies themselves continue delivering the service. These are the specifics I'm talking about. And also, in the same time, also trying to make plans for post-COVID recovery going forward in terms of making sure that we go back to normal service delivery by the water companies and availability to the people.
Great. Professor Bote, you wanted to jump in, I think, as well to address this point.
I think I'd just like to add to something that engineer talked about, and let me own up that I used to work with engineer at the regulatory board but I know he's done a lot of work and he can correct me if I'm wrong. I know that for the water service providers, there are certain standards that they are expected to abide by. And these actually include standards dealing with water being free from microorganisms, chemical substances, and other hazards. And actually, WASREB, which is the entity that engineer heads, produces a report that actually rates different counties, different water service providers, depending on the quality of water that they are availing to the people within their area using these standards that they've set. So maybe engineer would like to talk a little bit also about the impact report, because I've actually found it a very important way of taking stock of what's happening.
Right, and
Your
maybe
commission, Shamil?
No, I think you know, an interesting way to frame this is really thinking about the tool that Human Right to Water developed is meant to be a way to see how resilient a country is in responding to a pandemic. And in particular, you know, you could comment on either anything that you found interesting or striking about that report, but I could also maybe flag a few points for you, such as, you know, you mentioned access and access being a challenge. And one of the things that came out of the report was identifying whether or not a country, for example, is stopping cuts to people, households during a pandemic, or perhaps focusing more on expanding access to vulnerable groups. And I'm wondering if perhaps you could comment on that.
Yes, I can. In fact, the report we are talking about uses 9 performance indicators. And the first indicator actually is access, both to water and sanitation. And then you bring in water quality, and then you bring in water losses. And water losses is kind of also a proxy indicator of how the quality of management of the water service provider itself. But recently we have added a 10th key performance indicator, and this is service to low income areas. And this is where it would mean quite a lot in terms of addressing the vulnerable groups with respect to their water and sanitation coverage. So we in the next report, most likely we now include all the water companies, but the report I released this year was only covering about 50 or so water service companies. So this is really what we are talking about, and that access is one of the key criteria in the tool, in the Human Rights to Water tool. And we are also looking at issues to do with the non-retrogression of the right, because we really have to make sure that these companies are putting in structures that make sure that there is sustainable water services. But if you look at the tool, it is actually what we monitor with respect to actually progressively realizing the right to water. So in a way, it is kind of mirroring what we are doing here at Regulate. It might be very helpful for any outside person or even for comparison purposes from an international perspective.
So speaking of non-retrogression, have there been any specific measures taken in place in terms of COVID with respect to, for example, ensuring that people are not being denied access, or in terms of expanding service, you know, whether in rural areas, urban areas, additional steps that perhaps have been highlighted because of the threat multiplier that COVID presents?
I talked about formalization, and formalization here for us is key. You'll find that in situations where there is during this COVID, we need to put up water facilities. We as a regulator are insisting and making sure that those facilities are actually being managed by the water service provider itself. There has been sometimes cases where you leave these facilities to be managed by community groups. To a large extent, some of these groups actually turn into cartels. And that is really what we want to avoid by making sure that it is actually the responsible entity is the water service provider. because they really are the licensed service providers in that area. And this really helps the vulnerable people so that they are not left into the hands or held hostage by either that community group or any other cartels that might come up. And this goes also all the way to the rural areas. We have also published standards with respect to how we should address the formalization of water services in the rural areas. And I think that is now under implementation. And we believe that going forward, then we will be talking about a wholly formalized water service provision that can actually respond to whatever changes or any emergencies that can come and ensure sustainability of the water service provision.
Great. We just had a question come in via the chat that perhaps you could answer, which is perhaps just commenting on some statistics. Percentage of people in Kenya that have safely managed water, percentage of urban wastewater collected, and using treated wastewater for irrigation. So a few questions there, and maybe I'll throw on one more, which is, we heard that in Costa Rica, they'd begun doing some testing of wastewater for coronavirus, and whether that is a strategy that has at all been tried in Kenya.
Thank you very much. If you look at our focus is actually on basic provision. In the basic provision, we are talking about from regulated utilities, about 59%. When we subject that to the SDG standards, then we have a safely managed water provision of slightly below 40%. So we really have a lot of work to do there. When it comes to the rural areas, in terms of basic provision, we are at around also at around 30 or so %. But when it comes to I mean, I say safely managed, but when it comes to basic provision, and we are slightly higher than that. To comment about wastewater testing, of course, wastewater monitoring continues by our water service providers as part of a kind of highlighting whatever public health interventions may be made. But in terms of the COVID-19 pandemic, the available research does not really bring out the fecal oral route as a dominant route of infection. And it's basically a respiratory route of infection, and that is why we have not focused specifically to look at the coronavirus in the wastewater. But wastewater monitoring continues, albeit as a kind of trying to complement whatever other clinical surveillance may be there. That continues as usual in terms of our public health strategies.
Great, thank you so much. I'm wondering if we might be able to think about the tool that Human Right to Water developed, and maybe I could turn it over to first Professor Bote to comment on whether or not you think it's helpful for a country like Kenya that has done really such a remarkable job of implementing the human rights to water and sanitation in the face of great challenges and water scarcity and climate change and all of these other challenges, but whether or not a tool like this is useful. And then Engineer Gakubia, I'll turn it over to you for some closing comments before inviting Rio Hada to make a few remarks.
I would say that the tool is actually a useful tool. And this is because when you're looking at an issue like access to water, you're looking at a multiplicity of factors. And I think focusing on the different issues that the tool from Human Right to Water focuses on, it helps different actors look at how are we doing. And I think if you can see that there is tandem between the tool and what is being done by the regulator through the impact report. And I think I know the way the regulator works, that this could actually help to populate more issues into this space, and especially looking at that 10th issue, providing water to the underserved. Whether you're talking about people who live in urban informal settlements, or you're talking about women, or you're talking about persons living with disabilities, or even people in marginal areas where access to water is limited by the availability. So I would say that it is actually a useful tool, and it's actually going to help us as we look at how we are doing to continue improving. I think also having other country studies like Costa Rica and others, it helps us to see what are other issues that other countries are looking at, so that as we implement our human right to water, we learn from others. And that can only be an improvement and good for our country.
So Engineer Gakubia, I'd invite you to offer a few closing remarks, and perhaps in doing so, you could maybe comment on one piece that we haven't yet really covered in our conversation, which is participation and access to information and other pieces that have more to do with the process of delivering water and sanitation services. So perhaps you could offer a comment on that, and then any other closing remarks that you'd like to make about the session.
Thank you very much, Shamir. This country, or my country, Kenya, has a very comprehensive Bill of Rights. And those are the what you have mentioned are the non-technical principles that guide implementation of the human right to water. In fact, I cannot make any critical decision without public participation. It is my responsibility to unpack public participation, or rather operationalize a public participation principle in our constitution. I cannot give a license, or my board cannot approve a license without public participation. We cannot approve a tariff without public participation. And all these going forward are also supposed to be decisions that are open to the public. And this is something we continue to discuss. So it's very clear out there as per the law. And I also want to say that even in terms of access to information, this is a discussion we normally have with the water service providers, who sometimes claim that they have commercial secrecy. So I mean, for me, it is really a discussion between what is commercial secrecy and what is operational transparency. And these are things we also insist as a regulator, because people would like to, we would like legitimacy to be built in all the things we are doing, and even in the institutions that people trust to deliver their rights. So it is very important that everybody in the sector understands that. Unfortunately, in a pandemic or in an emergency, rhetoric goes ahead of actions. So we are talking quite a lot, but the actions are lagging behind. And I think in a country like ours, this is complicated by the many years of other investment in the sector, and the many years of sometimes environmental degradation that have actually kind of challenged the water sector for so much. But for the last 15 or so years, I think things have been looking up, and I believe crystallizing the right to water within the Constitution and even bringing in those standards within the Constitution are a very strong basis for building the resilience of the sector. In as much as we can see that there is really a lot to be done, we are actually starting off on a very firm foundation. Thank you very much.
Wonderful. Thank you so much to both Engineer Gakubia, Professor Bote, for really insightful and interesting perspectives from Kenya. I'd like to now invite Rio Hada to offer a couple of comments.
Thank you. And thank you for the presenters for excellent session here. I think, as Shamila said at the beginning, this session focused more on the implementation side after the recognition of the Constitution. I'm very struck by what Engineer Gakubia said, that the recognition in the Constitution really was a build up of his and colleagues' efforts. It's not just something that fell from the sky, but what follows after that in terms of implementation is very important. And you have highlighted some of the challenges. One of them was accountability. Water is a very complex sector, and with the multiplicity of actors, which makes it very difficult to ensure accountability. And you have also highlighted what you have done in terms of assuring accountability and transparencies through the impact reports. We have another project in Kenya, so I know a little bit about what's happening there in terms of access to information. I found that very interesting that the WASREP has a very innovative mobile-based application called Maj Voice, which enhances information sharing between service providers and consumers, and also has proper water sanitation service provision guidelines and a water sector trust fund to focus on financing water and sanitation service provision for the vulnerable and underserved areas. So I hope that the tools that developed by Human Rights Water could help to refine or further enhance the actual practical implementation of the rights to water and sanitation. And I wish you all the best for that. Thank you.
Wonderful. Thank you. We've gotten a couple of questions in the chat that we unfortunately just don't have enough time to really delve into. I should say that the Human Right to Water Resilience tool does in fact have questions that relate to toilet access, relate to sanitation, but perhaps, as is often the case, the conversation does turn to water as opposed to talking about sanitation. But fear not, these are aspects that everyone on this panel has been thinking about. When I reflect today, that today once again is Human Rights Day. And what really strikes me about today's panel, I just want to do a couple of minutes of just reflecting on what we've heard so far, is I'm struck by first the fact that Amanda kicked us off by talking about the fact that water and sanitation is often not exciting. And I think, Robert, in your remarks, you sort of alluded to that as well, saying it's a resource that's often underfunded. It's, pipes are underground, wells are underground, toilets people generally do not want to talk about. And what we're doing today is really important because we are talking about something and making it exciting. The other piece that really resonates with me today is the importance of leadership, that we are so privileged to have heard from really the top people in water and sanitation in 2 countries, in different continents, in different parts of the world, who are sharing their time to tell us that they are not seeing human rights as just words that are in a legal document. That it is easy to write words on a paper. It is much harder to make those words meaningful. And what we've heard today is the way in which rights that were embedded in a constitution had meaning, in part because of groundwork that was laid even before constitutions were adopted. We heard that in Kenya. We know that in Costa Rica, that they had so many pieces of the puzzle already in play and were ready in many ways to address a global pandemic like COVID, because they had a strong legal system in place, a strong regulatory system in place, processes for participation, but that they also were able to ensure that water and sanitation facilities were available at, everywhere, cinemas, households, various places with very high coverage rates. In terms of thinking about, I think another piece that resonates for me, so in addition to thinking about how do we make this exciting, the importance of of leadership, the fact that in order for human rights to be meaningful, we need to be having conversations between the human rights lawyers and the people who are implementing, and we're seeing that in place. At the same time, we are hearing about global threats. A global threat like climate change, severe weather patterns are exacerbating. And I come back to that threat multiplier comment that Professor Bote made about COVID, because it is heightening all of the inequalities that we might be seeing. And I come back then to Rio Hara's opening remarks about the vulnerabilities of elderly people, and in particular, the way in which COVID has heightened our recognition of vulnerabilities and vulnerable groups of people, but that perhaps, just perhaps, this might be an opportunity for that investment. So when we heard about Kenya, for example, not yet developing all of its water supply, or thinking about how do they actually address some of the long-term challenges, that perhaps now is the moment where the human right to water does become slowly, progressively, a reality for everyone. Because as COVID has taught us, we are all in this together. And really, when we all have access to this very fundamental and very basic services like water, sanitation, and hygiene, we will all live in a more just, equitable, and healthy world. So with that, I want to thank everyone for joining us today. I want to thank Human Right to Water for developing a resilience tool that has given us a platform for thinking across countries, and hopefully will be a tool that will be helpful not just to Costa Rica and Kenya, but to all of us wherever we work. So thank you so much, everyone, for joining us today.
Thank you very much.
Thank you.
Thank you.
Thank you to everybody. I really appreciate it, and thank you especially to Shamala for managing the second half of this program. Good afternoon.